I'll show you a couple of examples of companies that are trying to do this in an unobtrusive way, so that we don't have to make these decisions. We don't have to be in the driver's seat. The information and the insights will be increasingly coming to us to make those decisions as we go throughout our days. Technology definitely has contributed to where we are today in healthcare, and why you were hearing Aetna focusing on the consumer, which wasn't probably something that they had to do 5 years ago, but now everyone is supposed to think about this. Obviously, it's access to information, and there's, you can debate whether WebMD is the right destination, whether you get the right information, but I think there's the self-correcting mechanism that happens online, because all of us chiming in and all of us correct information, which is exactly what's happening with Wikipedia. So I don't know that that's actually a good thing. What happened with social media is that it made it really real, intimate, and relevant. So in and of itself, I think participatory medicine is now having its own media, which is phenomenal if you think about this, right? Because now there's journals, now there's communities, and I'll just share some of those. Susanna Fox is another huge advocate in patient empowerment, understanding, studying consumers, understanding what's moving them, where we are at the different stages. So just love there was a recent blog post from her that talks about peer-to-peer health, and that it does have the potential to transform the pursuit of health by letting people share what they know and what they want. It's like file sharing used to be, now that's what's happening in healthcare. There's obviously patient communities that are popping up. I guess to a certain extent, when you look at these communities, these are driven by the fact that we do have an acute need to connect with each other, and we have John here from Inspire, so definitely talk to him about what's happening with his community, which accidentally is a lot larger than patients like me, but I guess patients like me has been more vocal and maybe a trendsetter in the space in a way, and an advocate for all these communities that are happening there. So you're seeing people coming together to solve issues, and issues are not only medical issues, those are issues of support, of mental and social health, if you will, and this is how the World Health Organization is defining the overall well-being of a human being. So what's happening is that there's a ton of solutions coming to us, and they're revolutionizing healthcare, and they're pushing everyone from technology providers to payers to doctors to rethink how we do things. And it's just phenomenal what technology can do and what kind of an enabler it is. So I'm not going to go through all of them, but I hope you have a good glimpse into kind of what's happening in the space and why this is great. So if you think about this, we are used to the model where we call the physician, we schedule an appointment, we go in there and we get diagnosed. Well, we know that that has been changing. American Well has been trying to do that for a few years now, but now almost any one of us can do this with a tool like this. It's phenomenal that Hypnosis provides online diagnosis to common ailments, and you can talk to a local physician, or local physicians reviews your symptoms. You pay $25. If it's an acute condition, you get referred to a hospital, and they refund your money. It's just phenomenal what this can do for us, right? And how we can actually drive our own decisions. This is Health Tap, and I don't know how many of you guys are familiar with that, but that's another way of saying, rather than the patient going to the doctors can go to the patient, and you can make informed decisions. So there's 12,000 US licensed physicians, providing answers to folks with Health Tap. And there's the quantified self. I guess we are finally being able to be in control of our own health. Before the internet, before social media, we really didn't have the information, nor did we have the tools to make those decisions. So now, more and more, we can make decisions about what's happening in our life, measure what's going on. I don't know how many of you are familiar with the quantified self movement. Oh, right, no, okay, a few people. But it's phenomenal what's happening with the quantified self movement, because if you think about this, it used to be that we go to work and we can measure what we do. That's the whole premise of, running a business, that you set goals, you go ahead and execute them, and then you measure what's going on. That wasn't accessible to us as consumers until the internet and until the mobile device. So now we can do the same thing with our own lives, which is going to change the paradigm of how we think about health, how we manage our health, how we support the people, everything that we talked about up until now. So you were seeing different ways of going about and measuring life and understanding what's happening and how well you're doing, whether you need to do something extra.
So 15 people wearing Nike fuel bands the other day at an event.
Oh, right. By the way, I actually got this information from Circle Square, which is a great consultancy. I suggest you go to their website. They do a monthly email with recaps of what's happening in the healthcare industry, and this happens to be what's happening in consumer healthcare IT. So it was just topical and an easy thing for me to share with you guys. Wanted to share some of the health innovation that's happening in the space and look at the varied applications and the varied things that we're trying to solve. Body media probably is not new because we know the Fitbit, but there are some others that are trying to do interesting things like cell scope. Look at this, like you can diagnose, an ear infection with this technology, which would be phenomenal because my kids get them every 3 months, unfortunately. So I'm definitely buying this one. But it's revolutionizing how we think about every aspect of what we do, including taking care of our kids. So I love this quote from Jamie Haywood, who is a phenomenal thinker. And everybody keeps talking about, well, what's going to happen to privacy? And I think we as a society need to change the way we think about privacy. And the question is, how do we build a society where secrecy is not the method of preventing discrimination? It's not just healthcare, right? I mean, think about HR, think about working in any other company. I think it's a larger question than, are we HIPAA compliant? Can we say this online? Who's going to say it? There was an article in MIT Technology Review the other day by Phil Fernandez, who's the CEO of Marketo, who said, I was talking to an oil executive who said to me that all of a sudden all of their pricing was published on Twitter, and he was asking Phil how he can take this information off of Twitter. Like that sort of mentality, would need to change, and people will adapt, and we are not going to be as judgmental about, who we are and who we interact with, in the future. And I think we just have to evolve into a higher consciousness around this, not only in healthcare, but just, I guess, in everything we do. Another person that you need to definitely follow, I have a huge professional crush on, Jane. She is phenomenal. She is everywhere. She's an economist on top of everything else. She's been monitoring healthcare, huge patient advocate, huge Health 2.0 advocate. She's obviously on Twitter. You can sign up for her blog. So kind of the changing definition of health. This is a company that's local, Ginger Ale, probably one of the hotter or the hottest companies in the Boston area specifically. So what they're doing is they're basically taking the concept that comes from the World Health Organization that talks about health is not just whether you're physically healthy. Health is about being mentally healthy and being socially healthy, having connections, interacting with people. So it's not just one component. It's not just about diagnosis. It's not just about prevention. It's about this holistic thinking around healthcare. And you're seeing this actually being adopted as a way of thinking by the big data providers as well, because they finally realized that the genomic data is not going to be sufficient to know whether that particular treatment is going to be effective for you or not. So what is the future? I don't know that this is my personal thought, and I wish it was, but I work with this great guy from a future consultancy called Endeavor Partners. So what they do is they look at different industry and they say, what's going to be the future in about 3 to 5 to 7 years potentially. So his whole premise is that, to fix healthcare, we need to fix the distribution of income in this country. And if you compare to the U.S. to what's going on in the rest of the world, we're definitely apparently poorer in certain cases. And a lot of people in the U.S. don't have the same access to resources, information, and resource, when I talk about resources, it's even having the right food to eat, if you will. And so this is kind of one interesting company, Health Leads, that's trying to change that. If you look at this, what they do is they prescribe basically, they prescribe different cures, and that includes food, that includes support from local communities. So I think maybe that's one way to kind of think about where the future is going with this. So just in terms of the social landscape, I think it's super confusing, and I love this slide because this is what we face as people who are trying to impact change. I just love this slide because it just shows you that it's, you know, there's so many different ways to slice the beast, but technology is not that important. Technology is an enabler, and if we understand what moves people and how to get them from point A to point B, then you will find the right technology solution. And then you can see if you're more interested in kind of what we read and what are the resources that we use, at least at Scratch, and what really gets me going. These are some of the top books in the area when it comes to social and the social change, not necessarily social and healthcare, because, you know, I think it's a much more profound change than that. And if you haven't read The Diary of the Wicked Kid, please do so. It's really fun reading. So I believe that's it for me.
Fantastic. Thank you very much, Laura. Any quick questions, or I'd like to kind of move a little bit through our two last great speakers here. Miss Alicia Benjamin. You're going to get, there's probably going to be another 20 slides with Alicia, right? She's the social media manager for MeYou Health. And the interesting thing, she'll be talking about a little bit about, you know, what's happening with kind of wellness and kind of adding a layer of gamification to what they're doing, that helping people pursue and maintain a more healthy life and improving their well-being every day. So with that, the one slide.
And I'll try to keep this very brief.
I appreciate it.
I did my speaker. But I want to thank Digital Influence Group for extending the invitation to me. It's a unique opportunity for me that I really appreciate. We know health is very personal and life is very social. So today we're at the intersection of that, and I'm just thrilled to be a part of the discussion. Just a little background. In March of 2010, I was the first non-technical hire to MeYou Health, which means I can't code. No. But I was hired to MeYou Health, which was a really relatively unknown startup in the South End. And at the time, MeYou Health was just a concept. We had no products, we had no brand, and we certainly had no community. But what we did have was a lot of questions. And one of those questions kind of spurred and created Daily Challenge, our social well-being product. And we asked ourselves, what would it take to get 3 to 4 minutes of your time every day to get you to do one small action that was designed to improve your well-being? So we asked ourselves this, we talked about it a lot. And I'll show you what I mean by one small action. If I can get everyone to stand up.
Yay.
We are a big believer in you learn through doing, and we believe in well-being and action. So this is a great opportunity to demonstrate what we mean through all the actions we do in Daily Challenge. Today we're going to embrace our inner flamingo. For 30 seconds,
Oh no.
exactly. 30 seconds, you're going to stand on one leg, and this is a great way to test your balance.
And people are going to take
And then after the 30 seconds,
don't forget that.
And we're not recording those.
Balance is essential to what we do every day, going up and down the stairs. And
30 seconds?
I'll tell you when to start.
I don't know what she's going to say.
This isn't the Olympics. Go there.
To make Karate Kid pose.
It might help to fix your gaze on a certain spot. And if this is too easy for some of you, feel free to close your eyes. So are we all ready?
Will you demonstrate first?
So you can do it. Just,
Is this
all
a
it
Karate
takes
Kid
is
kind
balance.
of thing?
You could Karate Kid it,
Oh.
tree pose it, just like hang out. It's just to test whether or not you're wobbly or pretty well grounded.
Just think plastics in Miami.
So I might be some nice shoes.
All right. Exactly. Perfect. So let's balance. Pick a foot. So some of these challenges, like this particular one, may seem really, really, really easy to some of you. But when we were writing the hundreds of challenges in Daily Challenge, we wanted to keep them approachable to the majority of our users. The core experience of Daily Challenge, is pretty straightforward. We send you an email every day that contains one small action to do that day. And once you complete it, you click the big done button, and you earn points. And then you're given the opportunity to share how you did it with others. You can switch legs if you haven't already. You all are looking pretty great. I'm impressed.
How much better do you get at this if you practice?
You get really well. You're good. Yeah. Oh, yes, I need to go into yoga. She's got it. All right, done.
All right.
You all just earned 100 points. Completing today's challenge. And even more so you have a better understanding of your balance, which I must say I'm really impressed. A good way to wake us up again. So thank you for participating. Daily Challenge will turn 2 in this coming September. To date, more than 230,000 people have signed up to use Daily Challenge since we launched. Of those, more than 1/3 have come in through social invites. Over 5 million of these small actions have been completed, with nearly 3 million people posting how they did it, sharing their experience with the challenge. Over 20 million smiles, which is our Facebook Live equivalent, have been given out. Over 42,000 5-day packs have been formed, which I could form a 5-day pack with a connection. And we have a social contract for the next 5 days to complete all 5 in a row. The reward is bonus points and just awesome high fives. More than 300,000 encouragements have been sent. Every day I'm given the opportunity to encourage one of my connections. Just a little nice personal nudge to say, you can do it, I believe in you, you got this. Obviously y'all, you're rocking it. We've also learned that a community built on social ties leads to greater engagement. In fact, 75% of users in Daily Challenge are in Daily Challenge for 30 days or longer. And 34% are active after a year. We also know that socially active users with at least one connection average twice as many challenge completions as those who don't have any connections at all. So beyond this data, what does this really mean for the improvement of well-being? Well, every day we receive hundreds of feedback from users who want to share their personal experiences with the product and how Daily Challenge has made an impact. And I'd like to take just a couple moments to share a few of those with you. Christina writes, I can never say enough times how much I really enjoy doing the challenges. I have never been so committed to something. It has been 121 days in a row. Of the most precious things is that my daughter and I have been doing it together since she invited me to join in January. The other great thing is all the wonderful people on my connections and those I meet as I browse through the public postings. Terry Rodison said, I'm a little bit isolated in my town, and Daily Challenges have really helped me feel connected to people. And Jan wrote us saying, this has been an incredible year. So many friends have come into my life through this site. Not only am I in a better place health-wise, but also emotionally. The challenges have been mostly easily accomplished, but there are those which entail much more thought and introspection. And those are the ones which test my heart. Having others who both struggle and breeze through the challenges has permitted me the opportunity to gain a comprehension of love and compassion like I've never experienced. So as we've hoped to this feedback, we know this daily small action approach is resonating. But beyond that, we know that it's the social connections that people make in the product that keep them coming back to the site, and it keeps them engaged. So knowing this, we asked ourselves more questions, and one of which was, how can we harness this power of the social network to help our members live the healthy, happy lives that they want to live? And currently, and Kevin mentioned some of these statistics before, the average person in the US has 2 discussion confidants. And 1 in 10 people don't have anyone at all they can talk to about important health matters. So what we're seeing with Daily Challenge is it's a really safe place for people to connect with others, to share their struggles, their stories, their triumphs. 1 in 4 social media users have posted about their healthcare experience. And more, like we've learned today, they're turning to social media for answers, for advice, suggestions. They're looking up YouTube, they're going to Twitter and Facebook. 1/3 of the consumers now use the social media sites for health-related matters. And interestingly, the average internet user in this country has 669 social ties in their network. That's family, friends, coworkers, acquaintances. But there's more to social than being connected in a product. And there's more to social than exchanging advice on Facebook. How many here have heard of the 6 degrees of Kevin Bacon? Raise your hand. Well, there's something similar in social networking science called 3 degrees of influence. Well, it might not be the most fun thing to talk about at a party. It's very relevant to talk about today. What if your friend's friend's friend, someone you've never met, had the power to influence your health, for better or for worse? This is the basis of 3 degrees of influence, meaning we do influence, and we are influenced by people up to 3 degrees removed from us, most of whom we've never met. So take Daily Challenge, for example. 3 degrees of influence suggests that for every user, he or she has the potential to influence up to 3 degrees of people. On average, we found that that's close to 300 million people per member. So by taking action, our Daily Challenge members are living a healthier, happier life. But more than that, they're creating a positive ripple across their social network. So when looking to learn more about how to harness the social network science to kind of spread healthy behavior across the internet and really change people's health, we turned to Harvard professor Nicholas Christakis, who some of you have probably heard of, and his co-author of Connected, James Fowler, who teaches at the University of California in San Diego. This book, which, how many have read it? Heard about it? I recommend it. I recommend it. Well, it essentially explains that behaviors, good and bad, travel across your social network like a virus, and that we are influenced by what others in our networks do, good or bad, because it kind of gives us permission to engage in that behavior as well. Smoking is a great example of this. Our social networks underlie things also like eating disorders, substance abuse, voter turnout, and generosity. Christakis and Fowler believe that your friend's friend's friend, again, someone you probably have never met, has more impact on your happiness than $5,000 in your pocket. And that your friend's friend's friend can make you fat or can make you thin. So we work with Activate Networks to understand how online social networks can be mapped and how they can be studied, so that we can really understand how Daily Challenge can harness this research to start spreading healthy behaviors across social networks, all for the improvement and betterment of health. So Nancy is another Daily Challenge member, and she wrote very candidly and openly recently on our blog, and I'd like to share this with you. Depression and social anxiety has plagued me most of all my life. Today is my 53rd day, and challenges have been completed every day. I apologize for getting emotional. When I initially started, I cried my first posting. I got embarrassed and I deleted it. Give up one article of clothing, that was the challenge. That one challenge woke me up somehow. My friend Becky invited me here. Since then, our relationship has become close. I have told her things I would never have told her before Daily Challenge. We've even met up and had face-to-face social time. For me, completing one small thing a day was something I would pat myself on the back for, just because I was able to actually do something. I've been sedentary for way too long. So to do a reasonable challenge and post how I did it and then get such a supportive feedback from what to me used to be virtual strangers has turned into what I now see as lasting relationships. As you can tell, feedback like this makes us emotional. Me in particular, because it usually comes into me as the community manager. But it really helps validate that what we're doing is resonating with people. And it does go beyond the gaming mechanics. Granted, that shows them a sense of progression, instant feedback that I did something good, I'm leveling up, I can support my connections. But it's making those friendships and having those aha moments that just gives us life every day. To have the developers code what they code and have me share what I share with the members. It really has been the best part of my role at MeYou Health. So up next, we're going to decide through a controlled clinical research trial that if this engagement we've seen in this social interaction within the product, does this translate into real measurable well-being improvement? The trial should wrap up probably September, October, and the results should be published later this year. So we're really hoping that with our product, with our users, with the mapping of the social networks, we can see if we can really inch well-being forward for these individuals. If you want to learn more about what we're doing, you can check us out on our website. I encourage you to join dailychallenge.com if you haven't. We have a couple other apps which might be interesting and relevant to today. We have an app called Super Friends, which is Facebook. It will map your entire Facebook network and show you who your top 3 connectors are. Those are the people who just connect you to everyone else. And we have something called the Twitter Wellbeing Tracker, rather. And it's going to score the well-being and health of your followers and compare it to your score. So you can kind of see how the influence is that way. So, thank you. Is there any questions? I didn't cry too much.
What sort of health metrics are you looking at to see if the daily challenge actually has some sort of meaningful impact?
Yes.
Okay.
Well, we use something called the Wellbeing Index. It's from Gallup and Healthways, and Healthways is our parent company. We're wholly owned subsidiary of them. So every day we re-sample questions. We'll ask you 1 to 3 questions of this 42 assessment questionnaire. And we're trying to see over a 30, 60, and 90-day period, this is particular to the trial that we're running, if we can inch well-being up a point or 2. And we'll resample you and we'll kind of like re-engage you to see how it's going. And that doesn't include phone calls to talk to you about how your experience was. So we do use the Twitter Wellbeing Tracker. I keep saying that. The Wellbeing Tracker within Daily Challenge. So you can take the full assessment right when you sign up, and you get your overall score. And then it's broken down into 6 domains, which include emotional health, work environment, life evaluation, based on how you feel today versus the goals you want to achieve in life, as well as the physical activity and the nutrition.
One more question back here.
Do you have a sense of sort of the average user of MeYou Health and what their demographic is, gender, age, that kind of thing?
I can kind of give you a broad spectrum. And when we first set out to create MeYou Health, we worked with Essential Designs to kind of create what would be our key demographics. Like this would be our community: the time-impoverished mothers, the validation seekers, the excuse makers. And we've really been interested to find that most of our users skew older. We have a lot of retirees, but we also have a lot of your average Facebook women, 35 and older, socially active, what you would anticipate finding online. We do have some men that I've personally reached out to kind of see how their experience is going, and they're really highly engaged. Really high. We have men with over 400, 500-day completion streaks, so they're getting validation that way, and then they're getting bonus through the social connections that they make.
I'm just impressed you got any man to do anything 30 days in a row, so that's fantastic. Alicia, thank you once again so much, and great story. dare us all to do the daily challenge and whatever's important in your life, but I'm definitely going to be checking it out. Our last presenter here is a friend of mine, Mrs. Alicia C. She's the community manager of the HIT community. Where she works and she provides perspective on health, information technology, social media issues facing patients and healthcare workers. She's also a 3-time cancer survivor and committed to making a difference in the healthcare community. And I wanted Alicia kind of to be talked about today to kind of speak last because to all the speakers here today, it is about supporting and understanding the community of the patient and the people around them that the entire healthcare and wellness movement should be focusing on, I think. And I'd love to have Alicia share her story.
Okay.
So thank you very much.
Well, thanks for having me today. Hi, everybody. I'm Alicia, and no, you're not hearing that stereo there. I'm thrilled to say there's another Alicia in the room today that actually spells the name the right way. So, go team. All right, so I'm honored to be here today. I'm here, I guess, as the closer of today's session to give you the patient perspective. So I'm going to talk a little bit about my experience as a cancer survivor and something, a community that I've built on Twitter. It's a virtual community. Just so it's almost like a case study of you're seeing how patients are taking some of these tools today, and when we find a need for something, we're creative enough to go out there and figure out how to do it, because we don't have time to wait for some of these things. So the title of my speech today is all you need is a hashtag and a dream. So that's a shout out to the New York State Lottery tagline, which I think is awesome. So my cancer journey. I am a 20-year plus cancer survivor. I like to, oh, thank you. I know, I'd like to thank the Academy. I was actually a 19-year-old college sophomore when I was first diagnosed with cancer. I grew up in Western New York, and unfortunately, 6 people in my immediate neighborhood developed either Hodgkin's or non-Hodgkin's over a period of 10 years. So it was after we left the area. My first little piece of health activism was writing a letter to the CDC when I was 19 saying, hey, there's 6 people in my neighborhood that have had lymphoma, you might want to come and check this out, because I could literally stand in my backyard and throw a tennis ball and hit the houses of everybody else that were affected. And I got a very polite letter back from the CDC that said, thanks, but it's not statistically significant for us to come study. And I'm thinking, okay, apparently I'm not statistically significant. And that sort of put the spark in my mind that something has to change. 4 of those people have passed away. My best friend is the other one that's still remaining, and she's actually in ICU in Buffalo General right now, dealing with heart failure, and she's on a respirator. So what drives me is the fact that I had friends that I grew up with that are no longer with us today, because that's how real this journey is for some of us. I was diagnosed with Hodgkin's stage 2A, had massive amounts of radiation, chemotherapy, surgery, you name it, I had it. Did very well for a while. Unfortunately, in 2004, I was diagnosed with breast cancer, most likely from the amount of radiation I had from the initial cancer treatment. So you're starting to see how these things sort of spiral. 2007, it came back, same breast, different kind of cancer, and I made the decision to have a double mastectomy with no reconstruction. And the best thing that came out of that was I added about 40 yards to my golf swing. So, you gotta find the positive in everything. So now I can outdrive my brothers, which is very important in a very competitive family. So they call it cheating, and they get in trouble with my mom. Anyway, so this is my story. This is the context that I come to what's going on in the healthcare arena today, especially in social media. I should put a little line item in about the mid-90s. I was having some health concerns, and they figured it had to do with the radiation that I had had originally for Hodgkin's. I went online at that point and did what every person does, you know, put in my symptoms and everything. And I stumbled across ACOR, Association for Cancer Online Resources, acor.org, and I signed up for that listserv in 1997. So I'd like to say I was like on the beginning side of this whole social media, social networking movement. And that listserv has been a godsend for me. I was probably one of the younger people to stumble into this very mature community of long-term cancer survivors. And the men and women that I connected with in that group have been very, very helpful in sort of guiding me, providing support. You know, if you get some sort of random symptom, the first thing you think, especially from my perspective, is the cancer back? Or what's next? And, you know, I'm just always waiting for the other shoe to drop, which is not the best way to live your life, but when you've got a community around you that you can sort of bounce these ideas off, it sort of lessens the anxiety of living your life day to day. So, March 30th, 2008, does anybody know what that day is? No. I signed up for Twitter. This was a unbelievable moment for me. I had friends that for weeks were like, you gotta sign up for Twitter. You know, we can see where everybody's going and who's going to this restaurant. We can, you know, constantly check in with each other. I'm like, why would I want to follow my friends? I know what you guys are doing. I see you on Friday nights. Like, really, is that enough? Boy, was this a mistake. And if I had known, I wouldn't have picked my college nickname. I would have actually done my real name. But Stales, it stuck. So here I am. First thing I did was Google. I put in cancer just to see what would happen. And I was amazed at the number of people that had cancer survivor in their profile. And I'm like, oh boy, I've just hit a home run. March 30th, 2008, I was actually in the hospital recovering from my double mastectomy. So now I had this brand new lifeline that at 2 o'clock in the morning when you're laying in your hospital bed and you're looking for a community of people to chat with and you can't call your husband because he's really going to be mad that you're calling him at 2 a.m. again. I send out a tweet, you know, who's up? Where are my cancer survivors, who's up? And there was always somebody on that I could chat with, tweet with. To me, this was like the life-changing moment. I want to tell you something about the way that I've learned how to use Twitter as a patient. Everybody knows hashtags, right? Hashtag Red Sox, hashtag Buffalo Sabres, hashtag cancer. You have an instant community when you use a hashtag, for good or bad. We've seen some wild hashtags out there. But for a cancer survivor to put hashtag cancer, people tweet out questions all the time. I'm dealing with this, XYZ, for, you know, my chemotherapy, hashtag cancer. People are watching these hashtags. People are searching these hashtags. You have an opportunity to build an instantaneous community for little to no cost other than your time and effort. It's a powerful way to find other people that you want to connect on around a topic or a disease state or something like that. I encourage you to go to this website, simpler.com, and check out the healthcare hashtags project, because what you'll see is a hashtag for almost every disease state you can think of. Am I missing one? No, there it is. Any healthcare condition that you can think of has been represented in this healthcare hashtag project. It's amazing what you'll find. Diabetes, cancer, different rare, very rare conditions are listed in here. And I really want to talk to you today about a community that I am very proud to say that I'm a co-moderator, co-founder. It's BCSM, Breast Cancer Social Media. It's a virtual support group that started over a year ago. So I should have thanked that. We just celebrated our first-year birthday. So all we do is gather on Monday nights, 9 p.m. Eastern Standard Time. 2 cancer survivors, myself and Jody Shover, who is in Texas, and Deanna Atai, who is a breast surgeon out in California. I've never actually met Dr. Atai. I met Jody for the first time at South by Southwest in this past March. We started a virtual community. The three of us had never even met, but we had shared tweets and Facebook posts about our experiences. Jody and I are breast cancer survivors. Dr. Atai is in the breast cancer space for her profession. I like to say it lends us a little credibility that we have a doctor that tags along for our tweet chats. But every Monday night, 9 p.m. for the last probably 13 months, we have met consistently talking about issues that are facing the breast cancer community. And to me, this has been a powerful way of how Twitter can sort of change the world. Oh.
Not to interrupt, sorry, I'm just curious if you have a lot of folks who are not actually dealing with breast cancer, but are caregivers and family members also.
Yeah, it's a good question. We do. We have an incredible mix of people. Breast cancer survivors, social workers, we have husbands of wives that the wife might not be on Twitter, but the husband is, and they attend the chats to learn how they can be better caregivers. So it's a global audience. We have members who log in from Ireland, the UK, Switzerland, and the Philippines on a weekly basis. So these people are setting their alarms to get up in the middle of the night to join us, which I think speaks very highly of, I think, what we've done here to create this virtual community. Oops. I guess that's all I'm going to say here for today. But I just want to point out a couple things from the talks that came earlier. Kevin, you talked a lot about data and the gathering of data. What I'm finding is data needs context, particularly from a patient perspective. So the running joke, I'd say, in the breast cancer social media community is friends don't let friends Google, or friends don't let friends use WebMD, because the data and the information sometimes that's presented there doesn't have the context that a patient needs. Banks, somebody else made the comment about banks lose money, like the trust deficit, especially in healthcare. Key thing to point out, I guess, and that is that there is a trust deficit in healthcare. Banks lose money, healthcare providers cost lives. And to me, that's why there's always going to be an inherent trust deficit, especially in healthcare, until we get our wrap our minds around these. All right, I'll take questions now about that.
Absolutely. First and foremost, thank you very much.
Sure.
Not only for your story, but also for what you've kind of helped set as a benchmark for and the community that you've helped establish. So
yeah,
thank you very, very much, and sharing that. So any particular questions for Alicia?
No questions.
No questions.
I have a question.
All right,
For your awesome virtual support group, do you have any way of like capturing all those tweets, like Storyfy afterwards, so somebody could go through that?
We do. Actually, Jody does a Storyfy after everything, and simpler.com produces a transcript for us. So there's like a little transcript function. So you can actually go on and search all of our past tweet chats and pull it out that way. So yeah, so it's all there. You see everything we talked about.
Fantastic. I'd like to bring up all the speakers now, just to kind of open it up to additional variety.